So this is Dr. Melissa Mondala. She is a double boarded in family medicine and lifestyle medicine with an additional fellowship in integrative psychiatry and health and wellness coaching certificate. She earned her medical degree at Chicago Medical School, along with a double master's of biomedical science and master's of health administration. She serves as core faculty at Loma Linda University Preventive Lifestyle Medicine Department, which is one of the blue zones for longevity. She's an international speaker and has planted seeds of change in the community through lecturing at local medical schools, veg fests, and national medical conferences. Her passion is educating on healthy living and cooking at Dr. Melissa's Kitchen on Instagram and YouTube. She uplifts others through self-empowerment and self-compassion. Her life mission is to bring hope to those who are silently suffering from mental distress, autoimmune diseases, hormone imbalance, and long COVID-19. So welcome, Dr. Mondala. We are excited to have you here. I'm gonna stop sharing my screen and let you take over, okay?
Thank you, everyone. Thank you for the warm introduction. I know that you've heard Dr. Yu's presentation on just what ankylosing spondylitis is, the diagnosis and the treatment, but I am so excited to talk to you not only about lifestyle medicine, but how that applies to daily life, not only how to prevent it, but treat it and hopefully reduce your symptoms and reduce the medications if possible. I do want to say medical disclaimer that this is all for educational purpose uses. And if you do have specific questions, please consult your medical doctor or healthcare team. I'm very excited to show you the science, but also how practical this can be for your life. So I'm just going to share my screen, and I hope everyone enjoyed your sessions in your group. And we get to answer a lot of those questions you had with Dr. Yu in my presentation, but I'll get to your questions as well. So feel free to put it in the chat. I'll read them off and we will dive in. So with lifestyle medicine, it might be something new to you. It's always actually a lifestyle change that maybe you have not considered in the past, but it's something that we do on a daily basis, either healthy or unhealthy lifestyle habits. We often are eating, moving, sleeping, or consuming stress. So I just have a lifestyle trivia I want to ask. What percentage of the US population engages in 4 of these behaviors? So do they consume 5 fruits and 5 vegetable servings a day? Are they exercising 30 minutes a day, or maybe even 3 times a week? Are they not smoking, or are they in a healthy weight range? And I would say you can either put your answers through the Q&A. It's very, very uncommon to engage in all 4 of these, even in all communities. So it's actually not 21%, which we hope for, but it's 3%. It's tough to do all these healthy behaviors, and either because we don't really know how to do it, or maybe we didn't realize the power of it and how to incorporate it in our daily life, but it is definitely possible. So what is lifestyle medicine? So the American College of Lifestyle Medicine has been around since 2004, but the studies have been around for decades, and it's really based on an evidence-based way of saying nutrition, exercise, sleep, and stress are therapeutic ways to reduce chronic disease, to even reverse chronic disease. And so it's really one of the most powerful aspects of lifestyle medicine is being an active participant of your care, and being able to know that you can be in charge of your health and you can adapt these self-care behaviors for your overall well-being. And when we think about lifestyle medicine, it's backed up by 41 position papers, 21 medical societies, American Heart Society, American Cancer Society, the AMA, Diabetes Associations, the VA, and many, many more. So what actually affects the immune system? I know if you are here, you either have ankylosing spondylitis or risk for it. You might be a SpA or rheumi or some type of rheumatic autoimmune disease, and there are multiple risk factors. Science shows that not only is it genetics, either from generations ago, from HLB27, or there's increased risk when women get pregnant, but also age, gender, diet, your environment, what's around you. Is it pollution? Is it toxins? All these are actually risk factors. There are fixed risk factors, which I know that's hard to prevent, is your genes and how old you are, and if you get pregnant or not. But there are things that you can change, things that you can modify each and every day, which is your food, your stress, your sleep, your exercise, and what you're exposed to in your environment. When we think about rheumatic disease, especially ankylosing spondylitis, we see that not only does it affect the joints, but usually it's usually associated with other comorbidities. Most of the time, people have inflammation earlier in life. We know that people even in young age, teens, even I would say 10-year-olds, 12-year-olds, studies have shown that they have higher risk of obesity, diabetes, hypertension. And imagine as you get older and older, not only are you having inflammation and comorbidities, some people also have issues with their lung, their kidney, but a lot of patients, also women, start to have rheumatic disease, and you tend to get it in your 20s and your 60s. And so over time, there's higher risk of end organ damage. We know, sadly, it affects all aspects of our health, even increased risks of stroke, heart attacks, lung fibrosis, fractures, and kidney disease. So we definitely want to decrease not only the inflammation, but also decrease the comorbidities in our life. So we know that 6 out of 10 US adults have some form of chronic disease. 4 in 10 have at least 2 more. So often, not only patients or you may not only have spondyloarthritis, but some may have hypertension or diabetes. And we know that even comorbidities with other autoimmune diseases, you may have Sjogren's, or you may have RA, or a mixture of things. And so it's so important to know that all these chronic diseases are from inflammatory reactions in the body. And often we, as Americans, healthcare systems are spending tons of money just to improve these costs. $3.3 trillion are spent just to control, just to better manage these chronic diseases. But we know that lifestyle medicine actually addresses the root to improving both of these costs and also improving the health outcomes. So we saw through the COVID pandemic that people who had lower blood sugar levels actually had better outcomes. And if they had poor diabetes control, then they had worse outcomes. So that was 11% compared to 1%. In addition, we know that from COVID as well, that higher weight you are, the increased risk of comorbidities, death, and also COVID and post-COVID symptoms. So what impacts our life is really what we do in a day-to-day. So it actually impacts our weight, our blood pressure, our diabetes, but also our autoimmunity, increased risk for asthma, COPD, cholesterol, and heart disease, as we spoke. So I just want to share a little bit about me. Maybe Dr. Yu already shared his personal story, but I remember a time during medical school when I was just not only overeating, but I was stressed out, I was burned out, going to tons of not just classes, studying. I already worked double time in my undergraduate years, so I just noticed my weight was increasing, but also I had IBS, reflux, and GERD. However, through lifestyle medicine and changing my eating habits, I noticed that my symptoms reduced and completely went away. And really, yes, movement and exercise did help, but it's also nutrition. Sometimes we think we can exercise one lifestyle factor, but we really need the big picture and all these factors to see the best outcome. So as you know, as I went along in my career, I still not only saw improvement, but I also noticed that it helped reduce my risk of fatigue, mood disorders, and hormone imbalance. So with American College of Lifestyle Medicine, they have this beautiful plate, and it's a great way to just demonstrate we can benefit by half the plate being fruits and vegetables, and we want our plant proteins and our whole grains. And I had the choice. Do I want to just keep adding more pills and taking the reflux medications? Do I want to try medications that may not always work? Really, I knew I had to make a change because I wasn't feeling better, and I already tried most of the medications, if not all the medications. Now, during this talk, we're going to talk about the gut microbiome because it is the foundation. It is the core of our immune system, our nervous system, and this is how we can really heal from the inside out. So we'll be talking about oral microbiome briefly, nutrition, sleep, and mental health as we go through this. So in our gut, as I mentioned, we have trillions of bacteria. 60% is neurotransmitters, hormones, and the immune system. It's truly our defense mechanism. So whatever we are eating and consuming, it takes it in and it reads it. It actually disperses it to the rest of our body. However, this defense mechanism is very sensitive, and it shows here through this scientific picture that we have a bunch of T cells and cytokines that are basically trying to ward off any of the toxins that were exposed either by food or medications or our environment. So over time, when we are eating inflammatory foods, things that are unhealthy for our gut, we actually have digested food that leaks out. So in simple terms, we call this leaky gut. Usually you want this one cell layer thin to be nice and tight because that's where all the cytokines, interleukins are talking, and they're saying this is healthy, this is not. But over time, if we're exposing it to a high amounts of pro-inflammatory food, it's just going to start opening up and increasing the risk for autoimmunity, infections, and chronic disease. And what's the best for our gut? Really, it's going to be fiber and indigestible starch. So what does that mean? All the variety of fruits and vegetables. It's going to go through the gut, and it's going to create short-chain fatty acids such as acetate, propionate, and butyrate. And really, these are the anti-inflammatory factors. This is what heals the gut, heals the immune system, and goes into our entire body to reduce chronic inflammation. So here you have a beautiful way where it increases stimulation of mucus production, which you want because that seals the gut, that reduces reflux and GERD and damage. Then it's also increases IgA production. You want that because you want a strong immune system, and it also starts repairing, number 4. And that's also a wonderful thing. We do want Tregs, so those are the things in our immune system that help defend infections, disease, inflammation, and also IL-18. So all these pathways, all these steps occur in our gut, and how it's super important to get those fiber-rich foods to activate this whole process. Now we know with inflammation that it actually starts in the gut through gut dysbiosis. So gut dysbiosis is a term to basically say there's imbalance of the good and the bad bacteria. And the reason why we have bad bacteria is because we have pro-inflammatory foods from either chips and crackers and cookies, and I'll share those things at the end. But basically, that increases the risk for all these rheumatic diseases. As you can see, lupus, ankylosing spondylitis, psoriatic arthritis, Sjögren's, IBD, psoriasis, all these things contribute to the gut. And we know that when it comes to inflammation, once again, all these systems, 1 through 7, even depression, anxiety, and joint pain, especially autoimmune diseases, is because there's an unbalanced gut and gut dysbiosis. Now, it's important to understand something called advanced glycan any products. It stands for age, and it's not just aging, but it's age in terms of these are proteins and lipids that attach to sugars. So these are the things that are actually found in unhealthy burgers, chips, crackers. These are the things that are high in sugar, high in saturated fat. And once it goes through the body, it increases oxidative stress, inflammation, increases the risk for chronic disease. And especially if you put it at high heat, then you have more AGEs. And really the high heat can come from basically barbecues. It can be from fried foods, as you can see from the picture on the right. Animal products such as fried bacon have the highest amount. Roasted like chicken legs, grilled steak, they have high amounts of AGEs, and the lower ones are something like salmon or even plant-based foods such as vegetables, fruits, as you can see from the next slide. So processed foods and animal products have the highest AGEs compared to fruits and vegetables. As you can see, butter has a high amount in the 1100s. Peanut oil, chocolate chip cookies, chips also have in the 300s. Now, compared to fruits and vegetables, you see them really low. Bananas only have 9. If you look at kidney beans, 298. Roasted potato compared to French fries. French fries has over 1500. A roasted potato is much less. So it really also matters how you cook, and you want to definitely preserve your fruits and vegetables by steaming them, by allowing them to actually eat. If you like raw, then that's even better. So find ways to preserve your nutrients. And there's something also called TMAO. And TMAO is basically based off choline and L-carnitine. Choline is basically abundant in red meat, egg yolks, and dairy products. As you can see from the photo on the right, it also has L-carnitine, which also is found in energy drinks, red meats. And what we're really focusing on are the animal products that get into the gut flora. So here, when it hits the gut flora, it creates something called TMA. TMA makes TMAO. And so when it goes into the body, this also increases inflammation, atherosclerosis, stroke, heart attack, and death. So when it goes to the gut, it goes to the liver and goes everywhere else. And we have seen through research that those who eat more plant-predominant foods, they have less TMAO. Now, omega-3 and omega-6 is very important. High omega-3s through foods are definitely building blocks to our health, but also decrease inflammation. So that usually is in the form of plants. Mackerel, salmon, oysters, flax seeds, walnuts, soybeans, spinach are wonderful forms of omega-3. However, omega-6 can be a little bit more processed, so I tend to pick the better ones. From the list, I would say firm tofu is better, walnuts are going to be better, creamy soups. And it's really about the balance between the omega-3 and omega-6 ratio. And we want this ratio to be between 6:1 or 3:1. When we think about the Western American diet, there's not only high AGEs, but high linoleic acids, and it's because they lack omega-3. It goes through this complex system of how it's broken down. And we think about COX, these are like our COX inhibitors, like ibuprofen and everything. It's trying to help decrease the inflammation. But when you're adding all these pro-inflammatory foods, it hinders this healing process. However, on the right side, if you eat more whole food plant-based, especially through a Mediterranean diet, which is evidence-based as well, you have decreased inflammation, more opening, vasodilation, and less platelet, we would say platelet aggregation or stickiness or thickening of the blood. Now, it's also important to not only think of the gut microbiome, but also the oral microbiome. Our oral microbiome is connected to our gut, but also to our immune system. Not only do people tend to have more gingivitis and cavities and root canals that increase the risk of infection, heart disease, but also rheumatic arthritis, children's lupus, and many other autoimmune diseases. So it's very important to see your dentist, get regular dental cleaning, and make sure that you don't have any toxins in your teeth or even heavy metals. So now we're going to talk specifically about what kinds of foods or nutrition impacts autoimmunity. So I know out there are a lot of diet wars, a lot of debates out there. That you may have tried many protocols or read some books or podcasts, and it might be confusing. You may wonder how come they got better and why not me? So I'm here to just support you through this and just present the science and the evidence and how to help get you on the right track. So as I mentioned before, this food looks also familiar. It's holiday food, Super Bowl food. When you go to potlucks, they tend to have tons of pizza, donuts, chips, and crackers. And unfortunately, this is not an everyday food because this food can really negatively impact your immune system because of what I talked about, the AGEs, the TMAOs, and all the impact on the gut microbiome. As we can see here, even artificial sweeteners, sugar, so that's corn, high fructose corn sugar, white sugar, saturated fats are all negatively impacting our gut. However, the better ones, as you can see, are going to be things like phytonutrients, omega-3s. Gluten and other things I would say are patient dependent, and you may have questions for me later on. Salt negatively impacts our gut, so we'll be talking about that. And this also all contributes to the risk for autoimmunity and even cancer. So initially, the USDA tried to improve their guidelines. The reason why their guidelines may tend to be a little bit lower or different than others is because the pyramid, the food pyramid, has been evolving constantly over time. And there was a lot of debate. And also, we have to look at the science behind it, who was funding it. What was it, the meat industry? Was it the dairy industry? So we always want to find the source. I am happy to see that there's a quarter of the plate being vegetables, a quarter being fruits. They had some grains and some source of protein, and they were recommending dairy. However, when we look at not only the science, but also the US highly rated nutritional options and diets out there, we see that there was the Mediterranean diet, the flexitarian diet, Nordic, Ornish, and vegetarian. The top 5 are these here. And what they have in common between all these diets is that they're low in sugar, low in red meat, low in saturated fat, and definitely low in those processed foods, those packaged foods with tons of additives and high sugars and high salts. These are actually diets with high nuts and seeds, fruits and vegetables, and that was the common theme behind them all. Now, when we look at the science specifically for ankylosing spondylitis in 2022, there was research done amongst ankylosing spondylitis and other immune disorders, and they found that low starch was more beneficial, dairy-free, fasting, less calories, which actually means less saturated fat. Saturated fat usually is found in cheese, dairy, red meat, and more benefits from Mediterranean diet, more benefits from fish oils, olive oils, and some even from the low FODMAP diet because that was inflammatory bowel disease. We also see that improve with patients with IBS, and then gluten-free was also studied. Now, there's a lot of nutrition myths out there, so I'm just going to help you go through this as you go through the grocery store, or if you go to farmers markets, or maybe just order online because you're busy, or maybe still consumed by stress or even COVID. Some people are still fearful getting outside of their homes. So I totally understand. I get it. So I just wanted to help you understand what we need is not only with phytonutrients, but a lot of people ask me about calcium. And calcium is best found from foods, especially plant-based foods. Some people think you can only get it from milk or dairy. Yes, you can get skim milk and you can get 360 milligrams of calcium from that in 1 cup. However, many people don't know that a cup of almond milk has more calcium than skim milk. So that's 450 milligrams. That's a high amount of calcium, which is great for your daily needs. We need at least 1,000 milligrams per day. So technically, we can have 2 cups of almond milk, or we can have sides of broccoli, which has 125 milligrams of broccoli or of calcium. And then collards have 268 milligrams of calcium, and then soybeans have 98, and that's 1 cup. So you definitely can either get it in the form of soy milk if you wanted that version. So know that there are many options for calcium, just as you see here. Now, in addition, some people are extremely fearful of carbs because there's low carb diets out there. There's other things you may have read online. However, excuse me, not all carbs are created equal. Reason why is there's complex carbs and simple carbs. Complex carbs have healthy nutrients attached, such as fiber, protein, minerals, vitamins, and that's from vegetables, fruits, whole grains, beans, seeds, and full of energy and omega-3s. However, if you look at other carbs, such as a plain bagel or white bread, that's a simple carb, and that has not only low nutrients, but many more calories. As you can see from the table here, on the right, the plain bagel has 350 calories. So once again, that's unnecessary. However, you see steel cut oats, which is beautiful in the terms of fiber. You can see it has 150 calories, 5 grams of protein, 33 grams of carbohydrates, and that's okay. You don't have to be scared of that type of carb. 1 gram of fat and 4 grams of fiber. So this is an excellent choice for high fiber, good amount of protein, low calories, and this will help your microbiome and your autoimmune health. So when we think about nutrition, phytonutrients, you want to definitely taste the rainbow. You want variety of your foods and in your microbiome, getting a good balance of different microbes. Every color represents different nutrients, from your onions to your purple lettuce to your greens and to your carrots and tomatoes. I love to encourage a variety of this in your plate every day at every meal if possible. So now Canada's, I would say, recommendations have evolved over time, and the Eat Lancet. I love this because it shows even a better representation with less red meat, and it also shows more nuts and seeds and even no processed foods, right? And it's took out dairy out of the picture. Water is actually the best. Why? Because we need water, not only because most of our bodies can consist of water, but also it helps hydrate our joints, it helps hydrate our kidneys, our liver. It is our detoxifier, our natural detoxifier, because you get to urinate and poop out all that you're consuming or exposed to. So I love water. Make sure you don't shortcut your water. Aim for 7 to 8 glasses a day. And then when we think on the left side of the plate, once again, a variety of fruits and vegetables. And then with the Eat Lancet, once again, they're emphasizing more whole grains, more plant-based sources of protein. And I love that transformation. And don't forget your herbs, your nuts and seeds as well. Once again, this American College of Lifestyle Medicine showed this beautiful plate. Spices are wonderful. They're anti-inflammatory. And we don't want to forget the power of spices, including turmeric. I know someone had that question earlier. So how much fiber do we need in a day? It's important for us because not only do Americans lack fiber, most Americans are in the 15 range, and the daily recommended dose is around the 30s to 40s. And for men, we see 40s would be great, for women 25, but really I like to see them getting between 40 and 50 grams of fiber in a day. From this study in NAINS, imagine they're already studying fiber in the 1990s, and they're comparing it between different diseases. So this table shows us different quantities of fiber. And on the top part, it shows metabolic syndrome. Metabolic syndrome simply means someone with hypertension, diabetes, and someone who's overweight or obese. And then the second column is inflammation. And they basically show the more fiber you have, the less likelihood of metabolic syndrome you have, the less inflammation, and the less of BMI or the less weight you have. So there are so many benefits of fiber, and it's often underlooked. Now, there's been many studies, even into 2017, about the dietary intake in relation to knee pain. So this study showed that the more fiber intake you had, the less knee pain you will get over time. And here again are the varieties and options. I would say pick your favorites on the screen, even if it's pineapple, start with that, or cauliflower, and then add to your plate. So thinking about all the powerhouses in fruits and vegetables, we'll start with beta carotene. Often people know beta carotene as carrots are being good for the eyes, but it's not only that. It's pumpkin seeds, potatoes, sweet potatoes, squash, cantaloupe, apricots, spinach, collard greens, kale, and broccoli. So it's not just the yellow and green fruits and vegetables, but it's many more. And it's also the active nutrient is going to be very important, not just for your skin and bones, but for your immune system. Now, lycopene has been studied in cancer, specifically prostate and heart health, and that's found in pink grapefruit, tomatoes, red bell pepper, watermelon, and tomatoes. So if we want to decrease all these other chances of chronic disease, we definitely want to have the variety of those as well. Lutein is another one for eye health, cancer, and heart health, and pick your favorites there too as well. I'm a Brussels sprout fan, lettuce, artichokes, collard greens. These are wonderful. And resveratrol is a common one that we hear for heart health, lung health, but also inflammation. I like it in the form of grapes as being the best one. And then anthocyanins, blueberries, blackberries, red onions, red tomatoes, and radishes and strawberries. And then isoflavones, that's important for women. I know people who have autoimmune disease tend to be women, and people who are suffering from menopause or breast cancer or bone health need to have more isoflavones, even soybeans. So it's Breast Cancer Awareness Month, and I always like to encourage people to not only get screened and tested through mammograms, but eat foods to reduce the risk for breast cancer. And that's a half a cup per day. So here are other examples that can either benefit or actually harm the immune system. We'll start at the top. So I know coffee is very, I would say, controversial. Some bodies of research will say it's bad for you. Others will say possibly, maybe it's good for you. But I would say also first, it depends what you put in your coffee. Most of the time, people are going to their local coffee shops, and I won't name them, but they tend to have heavy creams, heavy dairy, high sugar, syrups that really make the coffee pro-inflammatory. But if you're looking at the coffee bean, studies have shown that possibly it can help. But I would say also check your other comorbidities. If you have high blood pressure or have anxiety, you might be raising your blood pressure and increasing other issues. Now, salt has also shown to increase pro-inflammatory macrophages and Th17 and IL-17, basically harming the immune system. However, these other ingredients, which I hope you all love or get to enjoy, first is something called capsaicin. It may be hard to tolerate for some, but basically it's some red pepper, and that helps reduce pain. It actually is found in a topical medication that's prescription to reduce joint pain, but also it decreases the proliferation of the T cells and helps fight disease through macrophages. Once again, we talked about resveratrol and omega-3 being healthy for our immune system. And then curcumin, there are tons of studies on curcumin for autoimmunity. And thousands and thousands, years of research have showed that it helps boost the immune system in a very healthy way with the T cells. And also chocolate. So chocolate's a fun one. I know we're all human out there. We love chocolate, and who doesn't? It's really can help improve your immune system and your cytokines. However, you do want to be careful if it has dairy and high sugar, cane sugar, and other things that may not be best for your immune system, or if you have diabetes and other things. So be careful, make sure you get some support, and try not to do this alone. If this is confusing, if you don't know how much to take, what supplements to take, please get help and guidance and supervision. So salt is very important because excess salt can really be pro-inflammatory. Studies have shown that this impacts all the parts of the immune system and increases the risk for flares, joint pain, and autoimmune disease. Now, we see from studies that when we are looking at different parts of our body, but specifically measuring the double-stranded DNA, and we know that rheumatologists tend to get this, the higher salt intake you have, the higher amounts of anti-double-stranded DNA. So that means your disease activity, it gets worse and it's higher, and salt is directly relevant to this autoimmunity. However, when we think about things to decrease inflammation and really start to heal the joint, we look at plants. We look at the fruits and vegetables, the beans, nuts, and seeds. So there's a wonderful study just came out in 2023 that showed a great randomized control trial for rheumatoid arthritis. And they showed a multidisciplinary lifestyle program helped reduce the pain and the fatigue and even the disease activity. So it's not just nutrition, it's other things such as exercise, sleep, and stress, which I'll jump into soon. Now, they also looked at fasting and a one-year vegetarian diet in rheumatoid arthritis, and they did show in 1991 that they were already seeing positive impacts in their patients. How beautiful is that to see that when we're able to not consume the pro-inflammatory foods and the processed foods, our joints also are happy and improve. Here they studied in 2018 the Mediterranean diet and RA, and not only helped with prevention, but also treatment. They've even studied a plant-based diet in multiple sclerosis, especially a low-fat one, and that also shown to improve. So really, it's shown in multiple autoimmune diseases consistently that more plant-predominant foods has been helpful. And even in 2022, they studied it in patients with SLE, and that's with our lupus patients. They've show that patients improve their symptoms, and it's really the foundation to our health. So I just wanted to take a small little reflection break here and just take a snapshot and let me know either through the Q&A what your typical kitchen looks like, your pantry, what's in there, what you tend to buy in your grocery, and see what you can switch up. What can you swap out? And here are my favorites that I have, Dr. You and I, when we start eating more plant-based, we did a cleanup. We started to really focus on whole foods, nuts, and seeds. So this was one of our first ways of getting healthier and seeing improvement. So I know a lot of patients may be asking me this question later and are maybe confused about dairy and why it's not so good for you. So dairy tends to have added hormones, antibiotics, and certain amino acids that promote inflammation. They definitely are part of the zoonotic diseases. We know that our agriculture farms have high risk of H1N1 viruses and bacteria. They also are high sources of sugar, salt, and cholesterol. And really, there hasn't been good studies how it's really prevented bone loss. So there's more increased actually risk of cancer, especially breast and prostate when eating heavy dairy foods. And most of the time, what people don't know is if you look at the population, 65% of adults are intolerant. But actually, if you look even deeper, they say 70 to 80%, especially if you are African American, of Asian descent, the percentage goes higher and higher. Now, what are better substitutes out there? So there are tons of other dairy swaps that you can try: almond cream cheese, nuts, ice cream, soy or oats. I'm not the best fan of butters, but if you need something just for seasoning, you can try plant-based butters and make sure it's not so high in salt and sugar. Coconut milk, or especially coconut water, is okay, and nut-based cheese. Now, what are the benefits of plant-based eating with nutrition and all that you're getting from fruits, vegetables, but beans, nuts, and seeds? You have not only benefits in your immune system, but you have decrease in blood pressure, decrease in joint pain, cholesterol, less constipation. A lot of people who come to me that really are just happy because when they eat more fiber, they have normal bowel movements, they're able to go regularly, and then their sugars are well stabilized rather than having spikes in their blood sugar or worsening diabetes. And that's the beauty of plant-based nutrition. Not only are you improving your immune system, but you improve all your other comorbidities. And also improves your skin, your acne risk goes down, and then improve brain fog. And when you have more plant-based foods, not only do you feel better, not just less brain fog, but also glowing skin. Most of the time, people are seeing that they're having younger appearance and better mood, thicker hair, and even weight loss and more stamina. So what do I typically recommend? And it's really according to what you see in the other research and the studies with those plates, but really having a healthy amount of grains, 3 to 4 servings a day, 6 to 8 servings of vegetables, 3 to 5 servings a day of fruits, and 2 to 3 servings a day of legumes. And I know if you might be taking a screenshot here, it may seem like a lot, but really it's just the variety that you can put in your plate, in your bowl, if it's a Buddha bowl, if you're making an acai bowl, or making a salad bowl, you can add different nutrients of your favorite food and pick your favorite toppings as well. Now, thinking about grains, it's really important to avoid the white pastas, the white rice, and white bread, and instead try more oats or seeded bread, brown rice, millet, quinoa, or even corn. Fruits can be edible, not just in the fresh form, but frozen fruits are fine. Frozen vegetables are fine. Steam them, bake them, find ways where you can enjoy them, and definitely limit processed juices because most of the time they're high in sugar. Now, what are plant-based proteins? You can have lentils, peas, chickpeas, black beans, pinto beans, and kidney beans. Some can do gluten, some may not. There's seitan and soybean, tofu, tempeh, and tons of broccoli and spinach. These are really great because they all fight disease and even autoimmunity and cancer. Now, when trying plant-based foods, we want to know that everyone is different. So it's important to get this with supervision and guidance and go slow. You may not feel the best in the beginning. When I say not the best, because sometimes you may not be used to it. You may not be used to eating the amount of fruits and vegetables. Some people complain of flatulence and gas. Some people are not used to the chewing. So I would say go slow and be patient. And also know that when you're trying plant-based foods, you may be needing other sources of foods or needing adequate vitamins. So this is important, making sure that you have supplements in vitamin B12, vitamin D, omega-3, iron, calcium, and zinc, because they tend to be deficient, not only in carnivores, which is very common, but also in plant-based vegans, vegetarians, Mediterranean eaters. So once again, let's take a pause here and just think about what you do eat already that is in the healthy category of phytonutrients. Where did you learn to eat? I know it might be tough if you have a family environment or friend circle that doesn't eat like this, or may not understand why you need to eat like this, or may be resistant and might even laugh at that situation. However, it's important to know that the science and the support is there for you. So just look at your plate, see what you can add that's healthy and that can promote good foods. And then just know that not all foods, such as fiber foods, may cause your bloating, reflux, diarrhea, stomach pain, or flares. It's important to journal this out with a registered dietitian. I know in remission and in my private practice, we tend to be watchful and really observe how you feel before you change your diet of any kind, because you want to understand what are your potential triggers. So once again, think about all the fruits and vegetables that you already enjoy, see what you don't have flares on, and see what you can add to your plate. And how we do this in my clinic at Dr. Lifestyle Remission is I like to set up goals, and you can do this for yourself. You can really find a way to be specific in the goal that you want to try, make sure it's something measurable, achievable, relevant, and time bound. And so that just stands for SMART. So sometimes we're working so hard trying to do the best we can. Sometimes we might even stress ourselves out, because I understand there might be a lot of anxiety around your diagnosis or trying to manage how your energy is and your way of life. However, if we work smarter, not so hard, we can get to our goals. And so an example of a SMART goal is filling 2/3 of your plate, or even if you want to start at 1/3 of vegetables and fruits in every meal, or start with meatless Monday if you wanted. And then if you wanted to be more active, an example of a SMART goal is work out at least 30 minutes every day, or even twice a week, or start with once a week, and make sure it's achievable. You don't want to set it too high, or you feel like I'm never going to get there, it's going to take me forever to get to that goal. You want to just start something at the reach of your fingertips with something you already have in your home. Now, I just wanted to share an amazing patient story and a testimonial. We have this in our remission, and he is someone who just did so well. He was a 20-year-old male. He was actually a former firefighter. However, he was diagnosed with ankylosing spondylitis. He had the HLA-B27. He had to stop work because he had too much joint pain, back pain, fatigue, and he tried everything, all types of diets out there, and he was doing the best to really understand what he can change. He was already exercising, he was active, he's actually a bodybuilder, but he still couldn't get his disease under control. He had a rapid 3 of 18, and basically rapid 3 is a measurement of your disease in terms of joint pain and quality of life, and his was 18, which is really high. He had morning stiffness for 1 hour. He was told to go on Humira by a previous rheumatologist, but he declined. He wanted to try something else, and he had multiple cortisone shots in his SI joint in the past. He's actually been taking Advil 3 times per week and prednisone 3 times per month, and still he had high pain. He came to really find how to improve his lifestyle rather than just using biologics. He wanted to see what his options were. So previously, his diet consists of high protein. So he had tons of red meat, chicken. There were some whole foods, less processed foods, but it was high protein. He didn't really have ultra processed foods, but he ate out once a week, and he had his cheat meal. His main beverage was water with little alcohol use, and he had a protein shake every morning. But he also had some bloating. Those were his abdominal symptoms. His labs, he had a CRP that was negative, ESR was normal, HLV27 was positive, and on his MRI, as we often see rheumatologists get, he showed severe swelling, which means edema of his left sacroiliac joint with erosions. So that basically means it was pretty severe with holes in his SI joint. And we know that he was really active, but he had to pause and really find a way to recover. So he came to us at Remission. And then supplements, he was on tons of supplements. I know out there you may go online and try to find out what's the best supplement for you, and it can be very confusing. And there's a lot of myths out there as well. So he tried all the supplements possible. He had a long list of digestive enzymes, vitamin D, some liver cleanses, DIM, ancient ultramarine krill. You may have heard of these or may have not. And really, we did our best to really take out the ones that were not necessarily and focus on the ones that were really focused on his immune system. So we wanted to minimize his supplement overuse and focus on lifestyle interventions. He was taking Advil and prednisone at the time, and he was sent to us so that he can make a lifestyle change. His rapid 3 went from 0 to 0 within 2 months. Imagine, it was high and it became normal. He found out that his triggers were rice, pea protein, gluten, and whey protein. With the help of our lifestyle medicine team and a registered dietitian, he was on a now more plant predominant diet, and he has no bloating and has better sleep. So his life transformed. So that brings us to the importance of sleep, movement, and substances. So when we think about sleep, we are typically chronically sleep deprived. It often starts in our teens when we're staying up late, either having fun or doing homework. Then with each decade of life, we often suffer from sleep deprivation because we are either overworking, having house chores, or not really developing a healthy night routine. And then by the time people hit their menopausal years or their senior years, their sleep not only goes from 8 to maybe 5 to 4, 3. And really, sleep deprivation happens often in America. You really want to aim for 7 to 8. And if you're getting less than 6, that counts as insomnia. So when we have less sleep, it increases risk for cancer, infection, neurodegeneration, degeneration such as Alzheimer's, dementia, and cardiovascular disease such as heart attack and stroke. And we know that with sleep, it is very integrated to our hormone health, our cortisol levels, our melatonin, our inflammatory system, all is impacted by our sleep. So how do we improve our sleep? It's important to maintain a consistent sleep schedule. No matter if it's weekday or weekend, really try to be consistent. If you are traveling to different time zones, it's important still to maintain your sleep schedule according to the natural circadian rhythms. Just like we see the sun go down and the sun go up, it's important to try to do that. Now, if you are in a noisy sleep environment or bright lights, that definitely impacts sleep. So you want to make sure you can use blackout curtains, quiet your cell phones, maybe put in an airplane mode to minimize the electricity around your bed. And definitely try not to look at your screens before bedtime. Often patients are looking at their TVs and phones right before as their source of relaxation. And I really encourage you, if you have high stress, to observe that. Why are you on your phone scrolling through the day and night? Are you really masking a stress or a conflict in your mind and in your world? And it's important to avoid caffeine late night, avoid even alcohol late night, because that serves as a stimulant in the middle of the night, and then avoid large meals. Now, when it comes to exercise, exercise is so important, not only because it decreases insulin resistance, improves your cholesterol, helps balance your immune system, but also it's been studied that increases your quality of life, your function, your range of motion, and decreases inflammation and pain. And often people don't know this, and people who have ankylosing spondylitis or some form of rheumatic disease, they often have rheumatic cachexia. That's because I know you might be in pain or fatigue, but over time, your muscles are shrinking and you're not able to really have good muscle health and bone health. And that's why we tend to see even more fatigue and less function or less hand grip. So contrary to popular belief and maybe some traditional doctors out there, it's so important to exercise and stretch. I just had a patient, she was 27 years old, that came to my clinic at Dr. Lifestyle. She said her favorite exercise was actually Pilates and yoga. And she said that helped her ankylosing spondylitis. That was her medicine. And as you can see from the graph, that when we exercise more, we have more anti-inflammatory factors when we do that. Now, not only is it important to exercise if it's through resistance training and reducing weight, it's because when we have fatty tissues, such as in obese individuals, we have more leptin. And when we have more leptin, we have more inflammation. So our body, even though it says eat more, or I'm not gonna, you can't sense if you're full, it's also because you're so inflamed and you're just spewing out more inflammation. Now, this is one of my favorite studies in 2020, where they showed that Tai Chi has been a part of the osteoarthritis recommendations. Even things like Tai Chi, Kung Fu, Chinese acupuncture can all help. Fibromyalgia has been studied with Tai Chi versus aquatic therapy. So versus swimming, Tai Chi had similar or greater improvement than aerobic exercise. So you don't have to be fast, you don't have to be a bodybuilder, you don't have to lift heavy weights, but just simple Tai Chi, slow movement that stretches your body is really good, not only for your joints, but even your nervous system. Now, we've seen more and more studies of Tai Chi in rheumatic diseases, and I love seeing the research support this. I see that the best exercise, though, is the exercise that you enjoy and then that you can do. And it's simple. You don't necessarily need any equipment, and that's through walking. So walking is nice because not only can it be meditative and relaxing, you're in nature, but really you're changing the scene, and it's free at no cost. So it's so important for you and everyone out there to try walking a couple times a week or a day to help your joints. And then pick your favorites on here once again, if it's aerobics, if it's just being in the pool and moving your joints at the local YMCA, try Tai Chi. They have some free classes, or find a yoga video online. And once again, stretching is important. And some form of resistance training, because we do want muscle strength and bone strength. Thank you for all your questions. I'll be getting to them very soon. Now let's start talking about smoking. So we know from research that there's a high association of not only tobacco use with the incidence of spondyloarthritis or rheumatic diseases, but also that it increases pain, inflammation, and it's not only linked to lung cancer, but autoimmunity and structural damage. So it's so important for you, anyone suffering from addictions. I understand it's really tough. Sometimes it takes 6 to 7 times to quit. I would encourage you to get support, find a lifestyle doc, someone who can support you on your journey to reduce your smoking use, to try other alternatives, because your joints will thank you. Now, alcohol and disease activity in axial spondyloarthritis has been studied in 2017. So once again, alcohol is pro-inflammatory. It is something that even at 1 glass, 2 glass, I have patients who say this every time when they have just a drink, it increases their pain, increases their flares. So we know that not only does it turn into sugar, but also negatively impacts our other organs. So if you are drinking heavy use, or maybe you're still drinking and need support, please seek help. And just a shout out, I did do an alcohol podcast with SAA. So if you want to hear more, I have a whole hour on that. Now let's talk quickly about mental health. Mental health is so important to me because we see that 2 or more unhealthy lifestyle factors is associated with impaired physical and mental health in patients with spondyloarthritis. So not only are patients probably struggling to eat healthy foods or struggling to exercise, but they probably are having a hard time with depression, anxiety, ADHD, some type of trauma. And so it's really important to understand the mind-body connection, or even the mind-body-spirit connection. Oftentimes we are stressed out, overwhelmed, and we forget to be aware of our thoughts, our energy, our stress levels. So I really encourage everyone to see a psychologist, to get mental health support so they can regulate their emotional well-being, maybe things of the past, maybe currently, maybe in your home environment. And this can directly impact your risk for pain and inflammation and flares. So there's something called the vagus nerve, but also psychoneuroimmunology, which I love to teach about. And basically, it's showing how the brain has a direct link to the vagus nerve and to the immune system. And that innervates all the systems. So when you're stressed, depressed, or anxious, you're more likely to get inflamed. And they also seen that if there is childhood stress, that there's more risk for autoimmune diseases. And this was studied in 2009. Now there's something called adverse childhood events. So these are called ACEs. If this is someone that you know, or if this is you, please get support and get help, because those do impact your immune system. If you had any exposure to some form of abuse or witnessed domestic violence or went through a divorce, we know that 64% of people with autoimmune disease report at least one ACE. So it's so important to get support. And then we know that depression and rheumatoid arthritis and other rheumatoid arthritis diseases or autoimmune diseases have high risk for depression and other autoimmune diseases. So when we think about plants and nutrition, how do we overcome that? Not only by getting therapy, but also by eating plant-based foods. They show that 12,000 people who are consuming more plant-based foods for over 2 years, they had higher happiness and well-being levels. And that was about 8 servings. So over time, they had improvements of anxiety, depression, pain, fatigue, and their emotional well-being. All of this improved just by nutrition. So it's so important to incorporate healthy living, healthy plant-based living, and then some of these de-stressor techniques. So I love teaching about stress management. So vagus nerve exercises are important, such as humming, mindfulness, stress-based programs are definitely out there if you are needing it, biofeedback programs, being mindful of eating, slowing down when you eat, guided imagery, meditation, and of course, cognitive behavioral therapy. So to end, I just wanted to share one more testimonial. And this is with a patient. She was in her 60s. She had history of Hashimoto's, hypertension, and rheumatoid arthritis. She was diagnosed a while ago in 2005 and was placed on several medications. She started Humira in 2008 to 2014. She was able to get off her medications after more whole foods eating, but then her flares and her pain came back in 2023. And she had really bad, severe flares to the point where she had prednisone 40 milligrams every day, Humira 7 days, which was double the normal frequency that usually is recommended because it was so severe. And she was to the point when she came to us, she was still on prednisone 5 and 10 milligrams. She was very, very busy. She was a business owner. She was managing her family life, her sons who had mental health conditions. She was a caregiver of many in the family and to the community. She was a giver, but it was hard for her to take care of her stress and her health. And she was very, very anxious as well. And it was so hard for her to exercise. Before, she was a hiker and she loved pickleball, but she stopped all of that because of severe joint pain in her shoulder and couldn't get out of bed. Her BMI was 32 and her rapid 3 was very high at 22. And she didn't have any alcohol, drugs, or smoking, but RA did run in the family in her brother and multiple sclerosis in her mother. She was sent to us at Remission. I saw her. We had a dietitian, saw the mental health specialist, and together we were able to get her on a more plant-predominant diet. She worked on her anxiety and her stress level, incorporated vagus nerve exercises, and she was able to wean completely off prednisone and then go down to Humira every 14 days at a normal frequency. And now she's pain-free. She's one of my patients who not only is back to work, she is back to her hobbies, going to the lake, got to celebrate her birthday, but she also is going back to nursing school in her 60s. So there's something that happens not only when you have improved quality of life, having lifestyle habits that really give you purpose and strength, but also her vitality went up and she lost a lot of weight in the process. So if you want to learn more about me and my approaches or see me on my cooking channel, you can see me at Dr. Melissa's Kitchen. I am also found on my website, drmelissa.com. I have tons more recipes, guides, documentaries, books that you can see in the learning section. And then you can find me on YouTube, Instagram, Facebook, and TikTok. So I'm happy to be here. Thank you everyone for your time. And then I'm also in private practice at Dr. Lifestyle Clinic in Newport Beach, where you can see me in person or telemedicine throughout the US. But also we're very excited about remission because we have our integrative rheumatologists such as Dr. Yu and many more. And we have a whole team there and that's all telehealth, and that's in California and now going into Pennsylvania, and that's insurance based. So if you have insurance and you want some support, see us at Remission. And here are all my resources. Thank you, everyone. And now I'll get to the questions. I see all the questions here and I see it popping up. So I'm just going to start to read them. Great job. People answered 3% for that lifestyle trivia. Yes, that's very true. And then that was thank you, Jessica. And you also had another question. How can you find a lifestyle medicine doctor where you are located? Definitely, you can look and research. There are some directories in American College of Lifestyle Medicine or Plantrician. And we're happy to see you wherever you are. And then thank you for this question. Teresa has IBS and it's very difficult with digesting many vegetables and fruits. Right now, she can only digest mushrooms, zucchini, carrots, blueberries, cucumbers, spinach, and apples. Do you have any suggestions to incorporate any fruits or vegetables? Thank you for that question, Teresa. I know it's tough. IBS is challenging because our microbiome can be very vulnerable. And as I said before, slow and gradual is important. You also may need to do extra testing, confirm that it's IBS. Often patients don't get the full workup. Sometimes they haven't got tested for celiac or done other blood tests or scoops. So it's important to really get a formal diagnosis because IBS is a diagnosis of exclusion. And then to incorporate more fruits and vegetables, really, it's very patient dependent. I would say definitely see either a lifestyle doctor or a registered dietitian to help you journal out those with flares. But if you go slow and in small amounts, that might help. Any evidence between colonics and AS? That's another question. Thank you, Larry. I would say that I don't know of any research on that, any articles or solid evidence, but thank you for that question. And then there was another question. Is there any effect of cannabinoid system effect on inflammation? And is this a case for the use of cannabis? Great question. So a lot of people use either CBD in the form of oils or gummies or orally. And I would say our body actually makes natural cannabinoids through, I would say, having pleasurable activities, exercise, healthy lifestyles. You can increase natural cannabis. And I would say you definitely want to make sure it's medical cannabis if you're using that. There are other medications that are, I would say, similar to cannabis. And if you need that, I would say see an integrative doctor. Actually, Dr. Ewan, us at Dr. Lifestyle Remission help with that. So there is a case that there can be improvement, but I would say use it wisely and with supervision. And then there's another question. You would like my opinion on alamus, the garlic onion family. She believes it's personally very overused and toxic to our system, which contributes to the imbalances of the microbiome, which in turn creates inflammation in the body. Aluminums, for her, she believes they're good for medicinal, but long-term, and we're adding flavor. So Yes, I understand your question. So I would say most foods, phytonutrients, herbs, and spices are good for you, but everyone's different. There are some patients maybe have allergies to it. Sometimes they might have some sensitivities or might have some dysbiosis. So not everyone can tolerate it. It's also very genetic too. So if you're having any trouble, you definitely want to make sure you get tested for these special sensitivities, and get some supervision because it can be very complex. And garlic supplements, people are obsessed over that, and it may not be the right fit for you. And then thank you for that question, Debbie. And we have another question. In addition to diet, hormones, can those impact the gut microbiome? And then any considerations with postmenopausal women? Yes, thank you for that question. So it's important to know people who are experiencing perimenopause or menopause, they have a decrease in estrogen and progesterone. And when that happens, our body not only struggles more in the immune system, our bone health, our heart health. So it's important to eat foods that increase estrogen and progesterone. And if you need some support with bioidentical hormones, get some support from your doctor. I was actually wanted to feature Generation M. This is a great book by Dr. Jessica Shepard. I contributed to this book. It's on pre-order. So she talks about it here. And I have a section that I talk about lifestyle medicine. And so you might want to see more resources here, Generation M. And what type of, oh, here's another question by Jessica. Thank you. One of the hardest things to do when trying to follow a Mediterranean diet is to think and look up recipes to cook. Is there a website that you recommend that provides examples of breakfast, lunches, dinners that follow Mediterranean diet? Yes, there are wonderful recipes out there. There's many Minimalist Baker, Plan to You. There's a bunch on Instagram, YouTube, and you can find them free through apps as well. I have a lot on my website. It's actually, I love Google now. There's a lot there, but I know it can be very overwhelming. So I like to really pick the most simple ingredients and maybe 3 to 5 ingredients per recipe. And when you're going through these recipes, just stick to your favorite 3 to 5, and maybe months later you add a little bit more. Try not to do 20 recipes at the same time or 20 different ingredients. You want to just find out what you already have so you don't get overwhelmed. But great question. That's one of my favorite things to teach on. And then there was another question on, I saw a question on chocolate. What type of chocolate is better than others? So definitely dark chocolate is going to be the best because it has more cacao. Even carob bean is good. HU is really good. Hue is my favorite. Tons at Trader Joe's or Sprouts, Whole Foods. Anything with dark chocolate, it's really great. And then there was a question, is a common side effect to experience diarrhea from taking omega vitamins? It possibly, usually for every supplement or every medication, side effects are always diarrhea, constipation, and nausea. So depending on how much you take and how you took it, it can possibly be a side effect. Thank you for that question. And then someone had a question, elimination diets seem to be used to identify foods that don't agree with us. What extent tools of nutrigenetics are useful to shortcut the process? Evidence seemed limited. Great question. So yes, there are tons of, I would say, functional medicine testing and even things that people buy over the internet, on Amazon, and it can be very overwhelming. You definitely want an advocate, a healthcare professional on your side to help you interpret it correctly, because it's very, I would say you get 10, 20 pages and it changes frequently from year to year based on your immune system, based on your gut or your dysbiosis. So I don't like to say that there's a true shortcut to it. I really would say get some help. And if you have any questions, reach out to us. Thank you, Sarah. You swapped white sugar for pure organic maple sugar or raw honey. That's a great way to make that swap. I love that. And that happened to me too, is I didn't realize I was having so much white sugar, and I instead changed to maple syrup. There's monk fruit out there as well. Someone asked, Heather asked, you want to start eating more lentils in your soups. I love lentils, and you love soup because you work very long hours. So I get it. I use my Instapot all the time. And you are thinking of preparing good, healthy soups in advance, especially this time of the year, right? We just want something quick and easy. You just reheat it after your busy day. And I love lentil soups. Bob's Red Mill has a 12 grain, which is 12 grains and beans in their line. And I just stick that in with herbs, oregano, paprika, onions, and garlic, and let it sit there. I like to soak my beans first because that actually helps decrease a little bit of the gas if you experience that, but also it softens it up. I really love soft beans, soft grains, and soft lentils. And then someone asked, are eggs a good source of protein or pro-inflammatory? Great question. So if you look at the sources of protein, there are tons of sources of protein, but then we learned here from the lecture, eggs also has saturated fat. So if you're dealing with cholesterol issues, it can increase your risk for pro-inflammatory diseases. Would you recommend sheep yogurt or coconut yogurt to get probiotics? Great question. So every yogurt is different. Always look at the sugar, salt content, and even the amount of probiotics. Coconut tends to sometimes increase even LDL. So I'm very careful. Sheep yogurt may be helpful. I don't know the evidence. I've heard about sheep, goat milk out there, but I would talk to your dietitian because you may have other sensitivities or whatnot, and know that probiotics, yes, can be found by yogurt, kefir, and kimchi, and getting a good balance of pre and probiotics are really important because that's what you call symbiotics in your gut. Thank you, Sarah, that you're going to switch white bread for whole grains. You're swapping some of your snacks from popcorn or chips to fresh fruits, fresh leather, yep, or fruit leather and nuts. So yeah, there's really great brands out there, even at your local Costco, Walmart, Target, with plant-based items with better, I would say, ingredients. Even though they're packaged, it's gotten a lot better with less sugar and salt. And then it's so nice to find better trail mixes, but just be careful because trail mix tends to have a lot of sugar and salt too. So I love just making my trail mix from scratch, or making granola bars, or mixing up your own granola. Why would a person not do surgery when the quality of life impact, and how does menopause statistically affect AS? Great question. So as I said from the beginning, this is for educational purposes only. If you need surgery, that's a decision between you and your doctor and healthcare team. So if that is you, I would say make sure you find out your options, know the risks versus the benefits, and it's important to know what could happen if you don't get the surgery. So I'm not going to go dive deep in that question. And yes, menopause does impact AS because of estrogen does help fight inflammation and progesterone. So that's why I practice a lot of hormone health in my own practice and talk about bioidentical hormones. Here's another question. What natural medicines or non-natural remedies are for maintaining and building energy levels? Great questions. So obviously I talked about foundational nutrition, plants, beans, seeds, chia seeds, flax seeds, that helps increase energy because they're in the form of omega-3. And I don't know your specific situation, so I can't make specific recommendations, but even coenzyme Q10 is great. Here's another question from Karen. And she asked, is agave a sugar alcohol considered part of alcohol consumption? No, it's different. If you're using it as a sweetener, it's different. But if it is alcohol drink, yes, that's because of the active alcohol, depending on the percentage, that still can be alcoholic, and actually not only affects your immune system, but it's linked to reflux, esophagitis, cancer. It really deteriorates your, I would say, not only microbiome, but your interstitial lining, your mucus layers in your gut. And then there was another question, how does marijuana or THC or CBD help AS while maintaining while not impacting energy levels or causing drowsiness? So I would say be very, very careful if you are consuming this, because some patients either overuse it or become dependent on it on a way because it's either impacting their sleep, it negatively impacting their sleep. It may initially help regulate their emotions, but I would say do this with guidance, because there are better options out there. With long-term use, it's been shown to increase nausea, and so I would say if you need some support, I like to find ways to support your current lifestyle and your use of it, but there are other ways that we can see that can even improve your disease. And thank you, Stefan. You read a study suggesting the supplement creatinine can help older adults avoid muscle loss when taken as part of strength workouts. Do we know whether creatine affects inflammation gut health? Great question. So there's a lot of creatinine powders, supplements out there, and we have to be very careful. Once again, there's not only additives and whey and pea that can be pro-inflammatory, but also some sugar and additives, heavy metals. So I would say be careful. The best source of protein comes from food. And if you find creatinine, you want to make sure you have a clean source. And they said, how do we get in touch with you to schedule a visit? You're in San Fernando Valley. Oh yeah, you're very local and close. As you saw, I'm at drlifestyle.org in Newport Beach, Orange County, or at Remission virtually as well. So you can see both websites and see what's a great fit for you. And then Sarah had another question. Since progesterone plays a role in regulating inflammation, what are ways to increase it naturally? Great question. So it's really hard with estrogen and progesterone to increase it naturally if you're ready in menopause. But if you're before menopause or perimenopause, you definitely want to have some good omega-3 sources, flax seeds, chia seeds. You can try soy, sweet potatoes, helps with estrogen production, black cohosh, and those other supplements out there. And you're welcome. I'm glad that you're learning, Jessica. I'm happy to help anyone out there. Someone, Desiree says she's mildly allergic to garlic. We have a lot of garlic questions. What's a good substitute for cooking? Great question. So, I tend to use onions, but if you can't do onions, I wonder if you can just try garlic powder. And if you can't have garlic powder, just find other spices. And people, you may not be familiar with smoked paprika or oregano. I love parsley. I love a lot of the Indian spices, Asian spices. So if it depends what you're making, but I know that garlic is a hard one. But if you can find other what we call in culinary medicine pungent or umami spices that are really flavorful, then you might not even notice the garlic is missing. Is there a way to eat legumes like beans and lentils without getting bloated? Wonder if their peel affects good digestion. Good question. So often, like with fruits and vegetables, their peels are the most nutrients. They have high antioxidants, for example, around your peaches and your apples, even around squash. With beans, you can definitely either mash it down, break it down. If you have it in a can, wash it out twice. You can put lemon juice on it or baking soda, and this can help bloating if you're having that. And Debbie, thank you for being interested in getting support for your lifestyle journey. I'm happy to see you. You want to know how to reach me. And I said earlier, Dr. Lifestyle Clinic or Rumishan for a visit. Now, Lily, you said, can one counteract knowingly eating somewhat? So you're saying if you can eat something inflammatory by eating something else immediately to quickly avoid a flare-up. Good question. There hasn't been that exact study, but I know we're human and we're trying to see, well, can I eat my favorite foods and maybe just eat a lot of salad? And, maybe the body can balance it up. But if you're having like for example, like a buffet, or you're having fast food, it's gonna hard, or when you travel, right? You're probably having a lot of doses of pro-inflammatory foods, but do the best you can and get some ideas how you can eat more plant predominant foods. Someone asked another question about what do you suggest for senior women on a non-dairy calcium intake 1,200 milligrams per day that has oxalate sensitivity? Great question. I know this is a very specific question. So Linda, I would actually have you see us in practice, get some support by a medical professional, because that's a very specific, and I don't want to give you the wrong supplement or advice without knowing your whole picture, but I would say yes, calcium is found in plant-based foods. Maybe try some algae sources, and maybe you'll be safer with less side effects. And then, do you recommend taking probiotic capsules for a person in an inflamed gut? Good question. Exactly. A lot of people have questions on probiotics, digestive enzymes. And really, when we think about our microbiome, there's trillions of bacteria out there. And when you take a capsule, it's really a drop in the ocean. So you want to be careful, not only because it may not have the biggest impact and may not get the outcome you want, but also even that one impact, if you're inflamed, if you're in a flare, we have to make sure we know what that probiotic is, because there's many types. Some are good for the immune system, others are not. Some are good for women's health, some are good for infections. So it's really important to know what kind of probiotic and how much. And sometimes people complain if they're taking the wrong one, their gut symptoms get worse. So they get more bloating, nausea, and more trouble with their gut and flares. And so, great question though. Thank you for the comment, Debbie. I'm glad that you're able to learn. You said it was very informative, and thank you that you're looking forward to improving your health and diet. And then I have another question here. Ashativa powder is a pinch of this Ayurvedic replacement to garlic. Oh, thank you, Debbie. Mung beans is the best source for bean and protein, easy digestion, nutrition. Yeah, it's great in Ayurveda medicine. Every person is different. The doshas are studied, and there are even cookbooks on this. So it's good to see an Ayurvedic practitioner, which I support, or even an acupuncturist, and see what your typical patterns are best based on your own, I would say component of your energy, your makeup. And I would say there are certain foods, always know that there are certain foods that may cause one to flare. So it's not one size fits all. All of this needs to be customized and personalized to you based on your health conditions, based on what you've tried already.